the proposal, and this gets to the more practical aspect of the work that I've been working on with colleagues in an organization which is called Incentives for Global Health, is to try to find a way to get beyond what Devin mentioned as what is often thought of as a fundamental dilemma in achieving the right to health, and that is that between innovation and access. That is, one of the things that seems to limit access to medicines, or one significant thing that is price, right? And price on medicines, patented and unpatented medicines, often has very much to do with intellectual property protection. So a lot of the debate about the right to health has been, in a sense, trying to attack the intellectual property system as realized in the TRIPS agreement and in other bilateral and national agreements as somehow violating or depriving people of their right to health. Right? Now, it's certainly true that intellectual property protection can restrict access, and this is presumably not a good thing. But of course, the other side of the argument is that anything you would do to weaken this protection would eliminate the types of incentives that companies have to innovate in the first place. So this is put very colorfully by commentators, which to say that it looks like it's a good thing in the short term if we were to simply override patent protection, if we were to make drugs widely available. But then why on earth would anybody bother investing in the extremely painstaking and expensive process of trying to bring drugs to market if they couldn't recoup on their investment? So unlike other critics of the status quo, the group I've been working with has not been challenging either the TRIPS agreement or any of the existing bilateral agreements that protect intellectual property between countries, but rather has been trying to offer an alternative complement to the existing system of patent protection that would create greater access to medicines for those who most need them, overwhelmingly poor people in developing countries, and yet at the same time protect innovation. So the thought we have, and we've been elaborating it in a proposal, and I have some booklets with me, and it's also available downline, is to create what is called a health impact fund. And the thought here is that you would try to further the fulfillment of the right to health by creating a fund which would reward companies on the basis of the health impact of their innovations. So each company facing the choice of how to develop a medicine would have a choice of either opting into the existing patent protection system or a health impact fund patent. And the idea there would be they would have a choice of whether they would think that they would better recoup on their investment, either by recouping on the high prices that they could hope to enjoy if they successfully bring their medicine to market after it's been patented, or would they recoup their investment better if they took out a patent in which they would allow anyone to produce it at cost, but they would be rewarded in terms of the health impact that their innovation actually had. Now, it's quite clear that the types of diseases that would attract innovators in different ways would be quite different. So probably hair loss drugs would not be the sort of thing that people would try to seek under the health impact, at least if health impact is measured in things like quality adjusted life years and so on, the normal measures that health economists focus on. Whereas other things, including so-called type 3 diseases, which affect almost exclusively poor in developing countries, would be obvious candidates. They would be the sort of low-hanging fruit that innovators would want to go to. Right now, innovators don't have very much incentive. They may have some goodwill. They may also be given some type of incentive through piecemeal initiatives that different organizations like the Gates Foundation have been providing for the development of these diseases. But they don't have anything like the same incentives that they have to develop hair loss medicine. They are oriented, and it's not because they are ill-willed. They are oriented by the current system of incentives to develop medicines that disproportionately serve the advanced needs of aging populations in wealthy countries. Now, of course, those needs are important, and we're not challenging the importance of those things or the rights of pharmaceutical companies to go in it. It's simply we don't think that there should be a trade-off between that and fulfilling the minimally adequate health protection needs of the poor people in developing countries, and not only there. So the thought is that creating a complement to the system, now how would it be funded? You need to fund it. And part of the thought of the proposal is that it would be funded primarily by governments, paying in proportion to their wealth into the system. Now, why would they do this? Well, in some sense, you could say it would benefit them as well. First of all, the wealthy countries who would disproportionately bear the burden of the cost are also where many of the pharmaceutical companies are concentrated. So they would, in a sense, be benefiting some of their important stakeholders and some of the more important firms that they have.